The Savelugu Municipal Hospital is a major health referral facility serving more than 60 communities and over 700 weekly OPD cases. However, the recent upsurge in Covid-19 cases among health workers has forced the authorities to partially shut down some facilities. The partial closure will only afford the hospital to attend to emergency cases until the final test result on health workers are released to the management so as to enhance the operational activities of the facility. In an interview in Tamale, the Deputy Director for Clinical Care at the Northern Regional Health Directorate, Dr. Brahma Baba Bubakar, said the initial contact tracing done among workers revealed potential health risks, hence the need for partial closure of the facility for mass testing among workers in the Savelugu Hospital.
The truth is that in the beginning of February, we had a number of staff who were infected. And let me emphasize that these staff who were infected, they stay in Tamale but work in Savelugu because, Savelugu is more or less like a suburb of Tamale now. So people stay here and work there. So the initial staff who had the infection were those who live in Tamale and then work there. So we can say that the infection was from Tamale to the hospital there among the staff. So, and as our protocol in managing any infectious disease, you have to identify the close people around the staff who got infected as contacts. Unfortunately, when the contact samples were taken, the results came back and a number of them were also positive, which means they also have contacts, so like it will begin to spread. And then when their contact results came, more people were infected. So then the hospital decided that, okay, since we have a limited number of staff within the facility and the way they contact, the results come positive, why don't we just screen everybody instead of doing a piecemeal where maybe there is that opportunity to spread it among staff. And the staff also are exposed to patients because they treat patients, both inpatients and outpatients. So they thought that, no, why don't let's screen everybody at once so that we know those who are positive and those who are negative. Those who are negative, we can see how we ration them to be able to render service. And those who are positive, now we can isolate them as the protocol demands so that we'll be able to have our hand on that. So this was the decision taken. And at the same time, once we screen everybody, we'll have the opportunity to just fumigate the whole hospital in order to get rid of this infection, or at least reduce it drastically to reduce the risk to patients and among other staff. Meanwhile, the labor ward, the theater are working. And then they've also set aside one whole ward, which will not be part of this, which will not be a part of the places where the staff will stay away. So that people who even have chronic illnesses and they come with complications that need emergency care, they will take care of them.
Dr. Brahma further said the over 60 workers who tested positive are being managed at home since the region do not have the capacity for such large numbers.
One thing we need to know is that all these over 60 people that we talk about in Savelugu, not one of them has even been admitted. Nobody has any disease that is severe enough to be managed in the hospital. So all of them have isolated and just being monitored from afar. So yes, the facilities are prepared, but like we said, the preparation aspect is to be able to quickly detect and isolate the people. So we are lucky that a lot of the staff have not been, because if they were to be admitted, in fact, this number alone, like we would have been overwhelmed. We would have been overwhelmed because it takes a lot of logistics to even manage one infectious case.
Dr. Brahma further urged the public to observe the laid-down protocols to reduce the spread since the region has recorded 586 cases and 24 deaths in 2 months.
This year, the 2021 edition of COVID-19 is not like the ones that we had the previous year. Because if you look at the spread, if I tell you that between January and today, 22nd February, the number of confirmed cases we have in this region is already more than or the total number of confirmed cases we had from March to December 31st, 2020. These 2 months, our numbers, both confirmed cases, both people who are dead, we've already passed the number we got in 2020. And we are just 2 months, not complete 2 months, because today is still 22nd February. And as we speak, samples are being run. And these days, we don't have any, like you send samples and everything is negative. It's no more like that. If you send samples, our heart is always beating. We always have palpitations because the results will come, some will be positive. The other thing is that people here will not want to come to hospital with what they have. So people come, they rush in, and less than 24 hours, they are dead. So a lot of the people who died, they died even before we got confirmation of their condition. Because people will not come to hospital early.
Noah Nash for GH1 News, Tamale.